Moses Walakira is a 13-year-old who hails from Mwakiso district. He traveled all the way to Mulago Hospital in Kampala to attend this sickle-cell clinic. More than 10,000 patients are registered here. Moses was brought in after a sickle-cell attack.
He
says the pain intensifies when it gets cold. After a checkup, the health officials found he had a heart problem.
Definitely, it is a burden.
A burden that grows in 18-year-old Safina Naziwa's body, who got admitted to the daycare clinic with her baby.
I take medicine for 2 diseases, and every day I take at least like 3 times.
Sickle-cell patients have to take medication for life. Every day for life.
Either of the two conditions keep bringing her back to the sickle-cell clinic.
It's been too much. The pain is too much for me.
Dr. Philip Kassidy is a pediatrician who heads the sickle-cell clinic at Mulago National Referral Hospital. He says the most common manifestation of sickle-cell is pain if any part of the body is deprived of blood.
The other one may be reduced function. Some of them may have stroke if it involves the brain. Others may have other complications in the bones. So part of that bone may actually die.
When the abnormal cells are destroyed and they get anemic, most times the patients need blood transfusion. The patients are fragile. For someone having sickle cell, it is imperative that they do not get infections, especially malaria.
Malaria naturally destroys the red blood cells. Now when it comes to sickler, the effect is worse.
At the hospital, they are given Fancida tablets monthly, depending on one's age.
Protect them against the malaria infections. But we advise at family level people to use them insecticide-treated bed nets, and as well as the other measures.
They are also at a high risk of getting strep pneumonia, the leading cause of pneumonia in children under 5.
We need to have them immunized.
While the countrywide approach is to immunize children under 1 year, those with sickle cell under 2 are also immunized. Another infectious disease that Dr. Phelps says he wouldn't want to envisage in a sickle cell patient is HIV.
Because both of them require a lot of medication, daily medication throughout your lifetime. Okay? And these medicines are not palatable, they are not tasty, they are not easy to take. They have side effects.
Dr. Phelps says that routine blood transfusions, which are part of the main treatment of sickle cell anemia, are always double-checked for safety. About 25,000 babies in Uganda are born with sickle cell annually. Dr. Phelps says 50 new patients are registered every month at Mulago Hospital, a figure that he describes as unacceptably high.
Before you go into the reproduction function, you have to know your state, just like it is with HIV, such that you are informed.
The disease is genetic, and according to WHO, about 5% of the world's population carries trait genes for hemoglobin disorders, mainly sickle cell disease and thalassemia.
If you have sickle cell and you get a man who has no sickle cell trait at all, a gene at all, then you will have carriers. If you both have sickle cell, in other words, you have HBSS, you will only have products that are HBSS.
Prevention of infection through proper hygiene and sanitation is also vital.
Be well hydrated. Once these cells that have sickle cell hemoglobin, one of the things that they are sticky, they are brittle. So one of the things to undo that stickiness, that clumping together, is a good state of hydration.
In a day, I have to take at least 5 liters of water, and then as there's like passion fruits, juice, tea.
While for long, sickle cell anemia has been neglected by everyone in the country, the Director General Health Services in the Ministry of Health says that Uganda has in the past 1 year made great strides.
We are now aware about the districts with the highest prevalence, notably Gulu and Lira, And we have gone ahead to launch screening programs as well as treatment programs in these 2 districts. We are hopeful that in the very near term, we shall roll out the program to the entire country.
Research regarding treatments by hydroxyurea is ongoing in the country by researchers from the University of Cincinnati and Malaria University.
We are working hand in hand with the National Drug Authority to make sure that it is accredited for use in sickle cell anemia, and as soon as this is done, we shall commence treatment of sicklers with this.
The treatment will not cure the patients, but it will improve their quality of life by improving their blood levels. Bone marrow transplant is the only known cure for now.
It's very expensive. It ranges from about 30,000 US dollars. In India, that's the operation per se. But cumulatively, it may actually go up to 300,000, 200, 300,000 US dollars.
Dr. Philp is optimistic that the country may be able to perform such transplants by 2040 at a lower cost. While the wait is on, you need to find a hospital and go get tested for sickle cell disease. You may save the life of your unborn child from this debilitating disease, which can prove fatal if it coexists with any other disease. Florence Naluyimba, NTV.